very good evening to you and welcome to the national briefing for Monday, 17th August 2020. Before I go further, let me apologize for the late start. I will leave it at that, and the chairman will take it up from there. We will be maintaining our format this evening. The chairman will come up to the podium to make his remarks, after which we'll take technical details, updates from the Minister of Health, the DG NCDC, and the National Coordinator in that order, before we move over to the question and answer session. So let me, at this point, invite the chairman to the podium to please present his remarks. Mr. Chairman.
Of the Presidential Task Force, distinguished ladies and gentlemen of the press, let me further apologize for the delayed national briefing, but just to assure you that we've been engaged in a series of meetings, all in an attempt to frame further course of action that this committee has to take in the coming days and weeks. In spite of that, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 17th August 2020. And to say Nigeria is gradually inching towards the 50,000 mark of confirmed cases of COVID-19, with the total number of confirmed cases standing at 49,098 as at yesterday, 16th August 2020. The Presidential Task Force has continued to observe the noticeable decline in fatalities, high discharge rates, and consistent under 500 daily cases for the past 4 weeks, in spite of the huge jump in our testing capacity and the increase in the number daily tested conducted. The Presidential Task Force wishes to strongly remind all Nigerians that we have not attained the desired level that would enable us to make conclusive statements on the rate of infection in the country. We must therefore continue to do that which gives us record improvements and desist from actions capable of undermining our successes. The whole had its highest daily increase of 294,237 confirmed cases yesterday, bringing the total to 22.4 million, with a cumulative death of 771,000. These statistics are daily reminders that humanity is still endangered by this virus. We are also reminded that countries that appear to have overcome the pandemic are actually being forced to reintroduce even stricter containment measures. As a country, Nigeria should not and would not lower its guard. And as a people, we should also improve our compliance to the various protocols at all levels. Today, the senior secondary school certificate examinations commenced all over the country, like in other West African states, and the Presidential Task Force is happy to note the high level of compliance with the protocols for the reopening of exit classes. It is in this light that we appreciate the call by the National Association of Nigerian Students, NANS, for the reopening of tertiary institutions. As a listening government, we wish to state that education is topmost on the priority list, and the reopening of our institutions remain critical within set safety parameters. I want to use this opportunity to appreciate the subnational levels of government for their efforts at advancing the risk communication and community engagement strategy. The Presidential Task Force is happy to note that their ownership of the strategy has manifested in many states establishing sample collection centers in all their local government areas, while those that are yet to do so are also working on it. Similarly, the establishment of treatment centers, which is contributing to the high number of discharge cases and reduced fatality in most local government areas, is worth commending. We are fully in the community spread phase, and one of the major measures we can take is to keep testing to detect, and treat. A number of countries have signified intention to repatriate Nigerians convicted and pardon and parole in those countries. They include the United Arab Emirates, Egypt, and the United States of America. Coming in the midst of our national response to COVID-19, all relevant agencies of government are taking multi-sectoral steps to ensure that the process remains within acceptable international protocols and in line with bilateral agreements. For the purposes of clarity, this should be distinguished from normal evacuation flights, and we wish to state that all evacuation flights will end by the 25th August 2020, after which airports will be given sufficient time to prepare for reopening. You will hear more about this from the Honorable Minister of Aviation as to the state of preparations. Our partners have continued to provide support for our national response. Over the weekend, the United Arab Emirates presented Nigeria with 7.5 tons of medical supplies and also facilitated the return of stranded Nigerians in their country. The Nigerian government wishes to express her appreciation to the government and the good people of the United Arab Emirates and its people. The Presidential Task Force similarly received additional PPEs from the Pharmaceutical Manufacturers Association and Messrs. Chazu San Ma Education Foundation, a Chinese company. Particularly, we remember with deep sense of gratitude the immeasurable role the late Malang Samaila Isa Funtua played in facilitating the donation by the Chinese company. May his soul rest in peace. Before I close these remarks, it is important that I plead with Nigerians to remain focused on our individual and collective fight to win this fight against COVID-19 and not engage in destructive information dissemination. One of such is the viral trend on the social media about collection of sums of money for a COVID-19 negative result. For the benefit of all Nigerians, and has been explained previously by the DG Nigerian Center for Disease Control, samples are only collected at designated centers and not at the airports. It is therefore inconceivable that test results would be given at the airports where only passports of returnees are collected. It is disturbing to realize that while a good number of Nigerians are sharing their experiences with the coronavirus and encouraging others to take responsibility, some very few Nigerians are bent on spreading misleading information. Let us remember, therefore, that this war can only be won when we individually and collectively take responsibility so that we can return to a life devoid of this pandemic. Just comply with the measures put in place. Wear your mask properly. Wash your hands regularly. Stay away from crowds. Maintain social distance and join the campaign to fight COVID-19. I now have the honor to call on the Honorable Minister of Health, the representative of the DG, Nigerian Center for Disease Control, and the National Coordinator to provide us with technical updates. I thank you so much for your attention. And once again, our sincere apologies for starting this briefing late. And have a very pleasant and good evening. Thank you.
Honorable members of PTF, honorable ministers and National Coordinator, Permanent Secretary, Directors, good afternoon, good evening, as it is now. As of the 17th of August, 2020, Nigeria has recorded 49,068 COVID-19 cases from 352,625 samples tested so far, with 36,497 persons successfully treated and discharged. We have sadly had 975 fatalities and a case fatality rate that is still around 2%. We continue to strive to lower the case fatality rate, aiming for something less than 1%, because we believe more lives can be saved from COVID-19 with the knowledge and system strengthening we have achieved over the past 6 months, even though I hasten to add that we do not yet know everything about COVID-19. But what we are sure of so far is that a strong response to COVID-19 is a collaborative effort between citizens and government for the benefit of all Nigerians. While government provides direction, guidance, and the resources, citizens are to take an ownership of this response. The apparently fewer COVID-positive cases of the past few days should give us no reason to start rejoicing yet or to lower our guard. As we expand and include small towns and rural areas in our testing scope, a more accurate picture of our COVID-19 status will emerge. There is good reason to prepare for COVID invasion in rural areas with more testing, first aid, ambulance services, and the commensurate isolation and treatment centers. However, we note with concern the development in many overseas countries, the development of sharp upsurge in COVID-19 cases after they lifted or relaxed restrictions on air travel, commerce, and especially social activities. We know that some countries had to quickly restore lockdown or quickly limit movement of citizens or to postpone elections in order to deal with COVID-19 spike. In one country, thousands of members of a congregation of a religious group had to be put in quarantine, having tested positive. These are significant lessons for us as we ourselves prepare to reopen our economy and as we consider options for resuming flights and travel operations or opening schools and land borders. Unless we utilize lessons learned and also learn from others to define and set measured precautionary steps to mitigate the risks, the danger of falling into the same negative balance in our own COVID-19 strategy and losing the gains made so far, that danger is real. The impact of lockdown on livelihoods and socioeconomic activities is well known and is serious, and it is what we wish to avoid. The other side of this coin is the question of what we need to do to mitigate the challenge, to mitigate the effects and take up the challenge of keeping control of COVID-19 as we reopen. This is a shared responsibility of government and people, and an assignment for the entire country. It has been repeatedly stressed that the easiest, cheapest, well-proven options are still the simple non-pharmaceutical interventions like wearing your mask, avoiding crowds, frequently washing your hands, etc., etc. This is a list that citizens can contribute by adhering to these measures and urging their neighbors to adhere so that we together can stand the better chance of limiting the negative consequences on the economy of easing and opening our borders. The continuity of health routine services, capacity building of health workers, and their protection are paramount to the Federal Ministry of Health, and it is therefore a good opportunity to now urge all our health workers to continue to focus on their assignments from traveler screening, surveillance, sample collection, laboratory analysis, to hospital and other forms of care. It is critical to maintain strict infection prevention and control measures at all times, to help educate the citizenry, to support uptake of testing and reporting early for treatment when the test is positive. We cannot afford to have many of our health workers going to quarantine. The national health system is responding well enough so far to the COVID-19 challenge. Collaboration with states and local governments remains a cornerstone of a successful strategy. The federal government is doing the needful to support funding to states, from disbursement of basic healthcare provision to funding from REDISE program and PTF and other sources which are under preparation. I paid an inspection visit to the Emergency Operations Center of the National Center for Disease Control for an assessment of our COVID-19 response efforts in the pillars under their purview, and I noted the strong strategies to improve the Call Connect Center, the surveillance, case finding and sample collection and testing, and in particular, the issue of turnaround time for testing, which were all discussed. NCDC is also making good efforts to ensure that all laboratories in our network have also a turnaround time under 24 hours. Nigeria continues to monitor new opportunities and developments in other countries, including new technology like saliva-based COVID-19 test that is under development. The Federal Ministry of Health is also working with agencies and partnering with state governments to serve rural areas by making sure that we maintain routine services and immunization. And we're also taking COVID-19 response to LGAs with sample collection, holding rooms, oxygen treatment centers, etc. State epidemiologists are requested to kindly speed up processing of test results and facilitate treatment and isolation of positives to address the gaps in the value chain. We have repeatedly also urged that all vulnerable with persons with pre-existing conditions need to be protected. I also visited the This Day Dome Treatment Center, where over 120 patients have received treatment and I note that the center is functioning very smoothly, I have directed that it be upgraded to a comprehensive level 3 center with ventilators and other critical machines for a functional intensive care unit and dialysis facilities. I thank you all for listening.
How to get tested. Now, this afternoon, we announced the 64th lab activated for COVID testing in the country, and that's in Zamfara State. We've gone from 5 labs in March to 64 labs 6 months into the response. To date, we have activated at least 1 lab in 33 states, and out of the 36 plus 1, that's FCT. Ultimately, we aim to make testing process seamless as possible for Nigerians, and that means we want to get it to all the 36 plus 1 FCT states. At the initial stage of the response, the known symptoms for COVID were limited to just a few, such as dry cough, fatigue, difficulty in breathing, fever. But as knowledge of the disease has evolved, we also know that there are some other symptoms that we need to look for, and that includes diarrhea, loss of taste or smell, aches, pains, sore throat, and every other symptoms that are very unusual for us. Persons infected with the virus can either be symptomatic, pre-symptomatic, or asymptomatic. The symptomatic cases show symptoms, and that's what most of us are looking for. The disease is usually mild, moderate, or severe, and can transmit the virus to others. The pre-symptomatic cases are persons that are infected and can still transmit, but do not have the symptom yet, but later show the symptoms. So at that stage when they are not showing the symptoms, they can transmit the virus. And then the asymptomatic cases are those that do not develop symptoms at all, but they can transmit. And we have a larger number of people that are asymptomatic amongst us. However, we have very vulnerable groups that develop severe complications, and they require intensive care if infected. These are mainly people with weakened immune system and people above 60 years with existing health conditions. As I mentioned at our last meeting, our strategy is to detect, isolate, and manage cases so that they can recover fast. And for us to achieve this, we also need all Nigerians to take responsibility and play their part. And that means if you develop any of these symptoms, or even mild symptom, weakness, tiredness, get tested, please. If you believe that you have been in contact with a confirmed case, or you suspect that you have been in contact with a confirmed case, and you do not have symptoms, get tested, please. It is very important that we do not self-medicate. While you may not develop symptoms immediately, you could unknowingly infect others, and gradually you might develop symptoms that will be severe and critical. So we urge that you do not self-medicate, please. To get tested, you need to simply visit the nearest sample collection center in your state. If you do not know where it is, you can get the state hotline, call the hotlines, Or you could also look for the state hotlines at the NCDC website. That's covid19.ncdc.gov.ng. When you get tested, please provide accurate information. That is very key. Sometimes we say we do not get our test results because we do not even provide the necessary information. Some do not provide the right names. Some provide very wrong phone numbers. So there's no way of getting in touch with the person. So let's provide the necessary information so that you can benefit from the care. Yes, we know that results, we have issues with results, getting results. But we're working with the states. We have a platform that we want to use. It's still work in progress. We've piloted it in FCT. We're working with the FCT team to launch it. And once that is done, we will escalate to the other states. And before we escalate, we have to do a lot of processing. Talk to the state, talk to the laboratory. So there's a lot of process involved, but it's work in progress. We will definitely get there. Finally, I would like to ask Nigerians to please seek information in the right places. Official channels, we've had complaints of several people being praised to scams. And please let us note, the NCDC is not giving people money and would not send any message to people asking for money to be employed. We are currently investigating these scams. Of course, the culprits will be brought to books. Thank you.
PTF, gentlemen of the press, good evening. Well, interestingly, all three of us have been talking about the same issue. The Honorable Minister of Health, the representative of the NCDC, and myself. We're all talking about testing independently without having consulted each other. And I think this really shows the importance of testing in terms of managing the COVID response. So as mentioned by the Honorable Minister, we're seeing a low level of positivity across the country, but it's important to understand, and we need to get that information out. It does not necessarily mean that the pandemic is waning or over. And this is a reflection of the number of tests we're doing, which still remains, even though we're doing 3,500 on average every day, but this is still insufficient, and it's not widespread. One of the main drivers for this is the poor demand that we have across the country. Our capacity, having opened 64 laboratories in the country, our capacity for testing is about 10,000 a day, but people are just not coming forward. There may be a number of reasons for this, of course. It includes stigma, it includes discrimination and disbelief, which continue to be key factors in not only our inaction, but also non-compliance to COVID-19 protocols. It's important to know that for every single case we get positive, we are missing a lot more. Not one, not two or three, but a lot more than that. So as a matter of urgency, we really need people to get tested in order to get a clear idea of COVID-19 transmission in the communities. Importantly, if people don't get tested, they risk endangering our older and vulnerable population who are at much higher risk. Our data suggests that the majority of people who get COVID in Nigeria are between the ages of 20 to 39. And these are the very group that will be running around either asymptomatic or having very mild infections, but still infectious and still able to transmit to others. And they are also the group that are least likely to comply with non-pharmaceutical interventions. So as a country, we need to understand that COVID-19 is still a significant threat to us, as well as the rest of the world. And more importantly, it's only by testing that we can get on top of the problem. Testing, as well as making sure that we follow those preventive measures. If we all test, if we all increase our testing capacity, if we are able to define where the problems are, the faster we'll be able to get on top of this pandemic, and the earlier we'll be able to normalize. So if you're experiencing malaria-like symptoms, fever, dry cough, loss of smell or taste, etc., it's really important you go to your nearest testing center. There are a lot of state governments that have received funds through the REDC grant, and state authorities will know exactly what I'm saying. These funds need to be used for the purpose that they have been released for at the state level, and we are appealing to state governments to make sure that these funds are used to expand testing, to improve the availability of sample collection centers, and also to be used for risk communication and community engagement right up to the grassroots level. We will be monitoring the usage of these funds, and we'll make sure that future funds reflect proper usage at the state level. So, testing steps. What do you need to do if you need a test? Well, you can call NCDC on 0800 97 00 0010. So 0800 97 000010 or 8099 55 5577 or 8099 555577, and we will ask TV stations to please put these numbers available, and 0087 110839 0087 110839, or your state hotline, which you can get the details of to book an appointment through the web if you have access to the internet. You will be tested, a sample will be collected, and results will be available within 48 hours. Our target, actually, our turnaround time should be between 24 to 48 hours for most laboratories, and we are working towards that. And those with positive results, depending on where you are in the country, will be advised either to go for home isolation and care, or if you are unwell, to go into a facility for treatment or for isolation. The PTF will continue to work with the state and local governments to drive testing information right down to the community level. And we are asking community influencers to please help share this life-saving information. Finally, in terms of acknowledgements, we are grateful to the Malam Samaila Isa Funtua family and foundation for their contributions to the COVID response. May his soul rest in peace. We are also grateful to the UN Single Basket, including the EU and the UN system, for donating a massive amount of commodities over the last few weeks, and the US government for supplying 200 ventilators, as well as the maintenance and the training that comes with them. Finally, we are also grateful to the Aliko Dangote Foundation for providing financial support as well as ventilators for the CPAP BiPAP study that is being coordinated by NIMA. Thank you.
Well, the good news. We are very glad today to announce that international flights will resume from the 29th of August 2020. It will start just like we did with the domestic. It will start with Lagos and Abuja. The protocols, procedures, and processes will be announced in due course. However, what we have become used to, physical distancing, wearing of masks, washing of hands, temperature taking, etc., will continue. So all protocols exist. They will continue alongside the opening of these airports. In the beginning, there will be 4 flights into Lagos and 4 flights into Abuja daily. We'll give further details on that in due course. And to say that this is a decision taken by the PTF, like we've insisted always, is a task force decision, not that of aviation. So it's aviation, health, immigration, and so on and so forth under the leadership of the Secretary of the Government, who is the chairman of PTF, and the national coordinator. So what would happen is that
very close to your departure date, as much as close to your departure date, you will take a test, COVID test, where you're coming from, very close to your departure date. And then, of course, you would online fill in the health questionnaire we will have, so that you don't bother yourself filling long forms while you arrive or in the aircraft. That will be the online that you fill of the health questionnaire, which you will deliver at point of entry to us. And then there will also be a portal that will be open. Prior to your departure, you will pay through that platform. You pay through that platform for a test to be done here in Nigeria day 8 after your arrival. Meaning that just before you depart, you take a test. Hopefully you are negative and you're not showing any signs of COVID, then we board you on the flight. You'd have filled online your health questionnaire, and then when you come, you arrive in Nigeria, go through all the protocols, and you exit the airport. So the 8th day after your arrival, which we would have considered the incubation period, you may, God forbid, you may show signs of COVID, and then you take a test at that time on the 8th day. So gradually, when we apply all of these protocols, I will explain later on, in due course, there may not be a need to keep your passport at the airport. So then that is that one. And then also to say that all of these, there is a National Air Transportation Facilitation Committee that involves all of the stakeholders, immigration, Port Health, aviation, everybody is working hard on all of these protocols, and will be released once they are approved by PTF. And what is also evident and factual is that we have been proven that yet, so far, we haven't had a case of someone who contracted the virus whilst flying in the aircraft, which we said here on this platform. So it is safe to fly if we observe all of those protocols in place. Then I would like to touch on something that was making waves, particularly on social media. That somebody said that airport officials are collecting money to pass for test. I think this is extremely unfair, and I understand there is something new now. People tend to believe everything they read, and if you run a common test, you find if you tell somebody the Quran says, he says which verse, you explain the verse, which is the verse that explains that verse, or which is the hadith that explains it, or the Bible says, and he asks you which version of the Bibles, and so on and so forth. But he will keep arguing that I saw it on CNN live, so it's true. It's on Arise. I read it on Sahara Reporters, and so they're factual. And that claim, the person who claimed that his cousin or friend or relative arrived at Abuja Airport and paid in lieu of his test, he should have said which agency, at least. Because in the airport, you have immigration, you have custom, you have port health, you have aviation security, you have all of these people there. He should at least say in that report which agency. That is one. And if he's so patriotic as to expose this, which we appreciate, then by giving, he is accomplice. By he giving, if truly he gave, or if it is one of those things that it's live, I saw it on Arise or TVC. So please be very fair in your judgments and what you can believe and not believe. I'm not claiming that there's no corruption. There's corruption everywhere in the world, in every single country. But please be factual so that we can get that person or get that agency and deal with them. We will not condone it, but please be very fair to people who are putting in their best in the service of their country. And I guarantee you, whoever is being found and it's proven that he's involved in one thing or another that is untoward, will be dealt with. We have every protocol and every procedure and every law in place, at least in places where we supervise. Thank you very much.
A quick update from the Federal Minister of Environment. By now we are all aware that examinations started today across all the exam centers across the country. And to report back to you that our environmental health desks were there, the surveillance desks, with all the environmental health officers on site to make sure that the protocols, the guidelines of COVID-19 containment are in place and being adhered to. And the report we received at the end of the closure of the centers, today's examinations, showed that a lot of things have gone very well, except for a few bubbles, which I'm sure in the next couple of days will all be ironed out, because of course it's just starting something new. So it will take a day or two for people to get a handle on all the protocols. So everything so far so good, is going very well. We'll still be calling on the parent to continue to advise their children to make sure they behave well at the centers and adhere to any rules and regulations to help contain the spread of this virus. The environmental health officers will make sure they maintain the centers with all the equipment that are needed. Temperatures will be taken. Make sure people wear their masks, maintain the social distancing, and every other protocol that needed to be observed, And as we have said earlier, they will be on site of these centers up until the end of these examinations. Jama'a assalamu alaikum. A gurguje, muna so mu sanar da ku cewa yau
2 million tests is aspirational. The WHO recommends that every country should aspire to test 1% of their population, and 1% of our population is 2 million, and it's aspirational that we want to be able to get that figure with every method we have. At the beginning, we didn't have that many reagents and that many laboratories, but now we have a lot of it, not more than at the beginning. And we are expanding the sites. You can't have a laboratory in every town. We have almost in every state now. But the strategy is to expand the sample collection sites because we have good reason to also worry that COVID, which moves with human beings, must have moved into many rural areas and small cities, and the need to be ready to attend to citizens in those areas is becoming clearer every day. So we work with state governments to make one general hospital, if not one primary healthcare center, minimum per local government area. And if it's a very large local government area, you can have more than one, so that we can collect samples. And not only that, the additional advantage of being able to have a holding room for those who are already showing symptoms particularly of distress. And we're also talking about being able to provide oxygen concentrators and ambulance service, and in some places, in fact, community treatment or community isolation centers. So we are expanding the reach of the clinical management of COVID-19, as we have said, to do everything we can to reduce the fatality rate to less than 1%. So that's why these measures are very important, and we hope with that we can reach 2 million in some time. It may not be in the time we promised, but definitely going that way, the speed with which we are going. The whole system is evolving. This is a large country, and it's evolving very systematically, and we're not slowing down in the way we are approaching that. Now, the question of low cases, yes, you are correct that in some places the figures have turned out to be low. There has been a lot of very diligent testing and case finding going on. In Lagos, they have a high burden, and in Kano, they also have a high burden, but we have also worked very diligently there. We have very experienced people there who are doing diligent case tracking, and the low figures we're observing, by the time the spread of sample collection sites and diagnostics goes into all local government areas, and we're able to collect samples and test, then we shall know whether it's a standard phenomenon or whether it is just temporary, and also the need to send experts to go and verify and work with the state governments to see whether the processes are as well as expected. So the verification and validation, let me call it validation, will need to be conducted before we can begin to say, yes, it is leveling out. We don't want to be too optimistic. So yeah, I think that's all for the health sector. Thank you. Discharge criteria, okay, thank you very much. Yes, at the beginning, the lesson was that you have to test negative twice within 48 hours. So if you tested negative, you have to wait 48 hours. But this is a new virus, a novel coronavirus, and it was found that actually after about 14 days, as a matter of fact, some studies say after 10 days, the virus actually is no longer active. And you should begin to test negative. If you don't test negative, you might still test positive, but it does not mean that the RNA, they find fragments of the RNA in your system. It doesn't mean that you are infectious. So, from general study, if after 10 days, we try to use 10 days or 14 days, depending on the way you look at it, to assume that by that point, even if you can still find fragments, find RNA samples in the molecular test, you can discharge because that is not infectious. Therefore, you can discharge after that period of time. It helps also to free bed space. If you know that someone, there are people who actually already tested negative. As a matter of fact, majority of people do test negative, you have to test them, but some still test positive, but they are not infectious. So the rule of thumb now is that as from 10 to 14 days, you can discharge somebody, provided they have no clinical symptoms. They must be free of clinical symptoms, will not be well enough, and meet all the criteria for wellness before you can let them go.
Question number 1 to the national coordinator, which is, will they quarantine when they come into the country? Meaning that they've taken a test and the test said negative. They're not showing any signs of fever, coughing, blah, blah, blah. And they had their masks, they've cleaned their hands, they're in a sterilized cabin of aircraft, and they arrived and still not showing any sign whether they will still quarantine. I will leave it to him. Whether they will pay for the testing, yes, they will. They will pay for the testing before they board, and it will be on a platform, online. They will pay just like you do your card, and it gives you all of the options of the laboratories to do, and then you do it on day 8. NC may like to also expand on that. Regarding the VIP who flouted our rules, I told you here also that the investigating is in the hands of NCAA and FAN, and they've been directed that once they deal with them, they will brief you. So they're handling. How effective is the protocols? Because somebody from Port Harcourt got a text whilst in the aircraft to show that he is positive. Well, I do know that most of us have received some form of a diploma in public health. We do understand that some people can be asymptomatic, which means they're not showing any signs. Okay? And he appeared at the airport. We ran through our temperature checks, physical examination. He has washed his hands, he has his mask, everything. We have no reason not to board him onto the flight. and suddenly a text came and he said he's positive. So if I were him, it doesn't take the passenger uproar or the officials to bring him out. So whether it is effective, yes, it is effective. Because we have not seen any case now, like I said earlier on, for somebody contacting within the aircraft while he's seated. So it is not that he beats any system in the airport to appear positive. It is that he took a test, and we don't know when he took it. The result only came while he's seated in the aircraft. So the option for him, I think, is to disembark and go and quarantine himself and seek medication. So it is effective. The airports are very safe, and the aircraft are equally safe. But we'll continue to observe and give no room. Intervention funds for airlines as they are laying their staff off. Yes, this intervention is in two folds. There's one through the central bank, which is a kind of a loan to the airlines and to aviation entrepreneurs, including travel agents, ground handling, etc., which will be given through their banks, and they have the procedure of taking it. I'm not aware if anybody has received yet. And the one from government is being processed, because everything to do with government, of course, there are procedures, there are laws to follow, and due diligence to be conducted. But certainly, some kind of help is coming. Thank you.
Mask. Okay. Well, fortunately for me, my minister has answered most of my questions, so I'll just go straight to the fatigue. Yes, it's a challenge, and I think if I can ask most of us here, most of us are fatigued because we all started this response at the same time. So it's not only the health workers that are fatigued, even you, the journalist, you'll be running after us, trying to get information, trying to pass out the right information, and so we're all fatigued. And how have we been coping? Well, it's not been easy, and I think at the NCDC, we have this mental health support team that help those that go out to the field. And when you come back from the field, you're counseled and you're allowed to go home and rest and be with your family for some time before you come back to work. That's what we do. We've also scaled down our meetings, our emergency operations center meetings. We've scaled down so that we'll have time to do other things. So I think in terms of fatigue for the health workers, it's a big challenge, and I think most states are trying as much as possible to work with the doctors, the nurses. We're all involved, not only the health workers, even you as journalists, we're all involved. Then in terms of the decrease, yes, that's what we have noticed, and that's why we've talked about the interventions we want to take. My minister just mentioned that we want to have sample collection sites in all the states. And that's why we're also talking to you, so that we convince people to go out and get tested. I just talked about how do we get tested. Most people are asymptomatic, so they feel they are free. They don't need the test, or they are okay. But sometimes it's possible where we might suspect that we have been in contact with someone that is a bit febrile and might be suspected COVID. Let's get tested regularly. Like we do in NCDC, every 6 weeks we test. Everybody, all the staff, we test. So that we are sure that at least we're okay. So I think we should all imbibe that kind of, every 6 weeks, go out and get yourself tested. There's no harm. I think that's all I can say. Thank you.
The Honorable Minister of Aviation, I just wanted to say something that's really important that the public need to understand. So when it comes to infection control, and when we talk about prevention measures, you assume everybody you meet is potentially infectious. And that's why we advise wearing masks, that's why we advise keeping a physical distance, washing your hands, etc. Because the day you're told that you have been in contact with somebody who is positive for COVID and you have applied those measures, it's very unlikely you would catch COVID. So that's a key principle of infection control. You assume everybody you meet or you come across could be potentially positive. so that when that information comes to you, just like we had in this scenario, you would have taken the necessary precautions to protect yourself. Now, moving to the issue of the gentleman, now it's important when stories come up in the social media to really think, how did this chap get a COVID test done if he was traveling domestic? We do not do COVID testing for domestic travelers. Okay? So unless he had a COVID test for some other reason and he was traveling, there is no way we would have known. And in any case, we don't ask people traveling within the domestic route, what's your COVID result? And it's the same issue with the chap who came in on international. If you look at some of the stories, for those of us that knew what our protocol is, you would know straight away whether the story fits or not, because there are certain things we don't even recommend doing. So anyway, I'll go straight to the point. Isolation. So what do we do at the moment? At the moment, if you're traveling from outside the country, evacuation, etc., you do a pre-boarding test. That pre-boarding test can be valid for as long as 2 weeks down the line. And you have a negative PCR test for COVID and you board the flight. The primary purpose of that test is really to provide additional confidence to the people that you are traveling with, that you are not infectious. Because if you have a 6-8 hour flight, what happens? You have lunch or you have dinner. Both of you remove your masks. You relax, you talk to each other by the side. So you increase your risk of infection. But for the travelers that are within the plane, it gives them additional comfort that whoever they meet within the plane has a negative PCR. But the way the incubation period works is, for COVID, the incubation period is up to 14 days. And when I say incubation period, when you are tested during an incubation period, what it means is the period when the virus is replicating in the respiratory tract. It hasn't reached the level that you will have symptoms, and it hasn't reached the level where you'll be excreting the virus. And because the test we do, a PCR test, detects the presence of excreted virus, if you have a test during the incubation period, you will be negative. You are far more likely to be positive towards the end of the incubation period when you start developing symptoms. With COVID, on average, it's a bell-shaped curve, but the majority will develop symptoms around day 5, day 7 of exposure. And they will be most infectious a day or two before the symptoms and up to 3 days after. So if you are leaving the UK and you do a COVID test, and that is very close to the time of your departure, let's say it's a day or two, and you board the plane, and you catch COVID on your way to the airport from your taxi driver, if you land in Nigeria and you have a test done on arrival, the likelihood is it will be negative. So which is why we say we test you as close as possible to the time of departure, so that we are sure at that moment in time you are not infectious. When you arrive, you go through immigration, etc. You've already paid for a test to be done in Nigeria so that we can catch any infection you might be incubating, but that will not be done immediately. That will be done around day 8 onwards, a week after your arrival, because that's when you are most likely to be infectious. So that's the reason why we say a pre-boarding test and a test much later, not immediately. And during that period, you self-isolate at home. There's no quarantine. We haven't been quarantining for the 11,000 Nigerians that we brought in, by the way. We've been asking them to self-isolate, so there's nothing new there. The details of this process, we will have a specific day, Thursday, hopefully this week, where we'll go at the PTF meeting. We'll spend the whole day discussing international travel, and we will go into the minutiae of how this will be done. We are grateful to CACOVID and its partners for helping to support this process, because it will help us to expedite the process of opening up the airport. And if I may, if the Honorable Minister of Aviation will allow me to clarify, we said from the 29th of August. We didn't say on the 29th of August, okay? We said from. So very similar to what we did for the domestic. Because don't come back and say to us that we promised we will open on the 29th. No, we said That 29th is not sacrosanct, but we will work towards it. We will seriously try and deliver it. But from the 29th, as far as the PTF is concerned, if aviation come to us and say they are ready on the 29th, please go ahead. If you come back on the 28th, it's too early. When do we know about whether high incidence countries will be stopped or? So at this moment in time, when we have significant community transmission in the country, and I'll give you an example of Lagos. Lagos, until a few weeks ago, was having about 250 cases a day. That's the equivalent of a whole jet of a whole plane of positive persons arriving into Lagos every day. We know from the data we have from the people that we've had coming in over the last 6-8 weeks of the evacuation, that if you have a negative PCR, the final about 5% will end up having a positive PCR on retesting in the country. So it means we are missing about 5%, okay? That 5% is a drop in the ocean compared to the community transmission going on. So the time when we need to be most strict on stopping any case of COVID coming into the country is towards the end of our pandemic period, when we are only having 1, 2, 3, 5 cases in Nigeria. That's when we would say any case will be unacceptable. But at this moment in time, we need to be pragmatic, and we need to know what we can do to make sure that the airports open safely, and we need to balance lives with livelihoods. We know that flights are ongoing already for evacuations, etc., and the airports need to start functioning. The longer they stay closed, the more difficult it will be for us to normalize. Thank you.
Involvement of Nasria to determine the impact of COVID-19 on the environment. First of all, Nasria is an enforcement agency. Their job, their role is to prevent polluting the environment, gaseous, solid, or liquid. The impact of corona on the environment by itself does not need to be researched. However, what the emissions that have been reduced are going to be researched. So, for example, we all know by shutting down the industries over a period of 1 month, 2, 3 months, we know a lot of pollutants have been reduced from going into the atmosphere or into our water bodies or onto the land. What can Nasria research on? What pollutants, what gaseous emissions have been reduced, and how much of these gaseous emissions have been reduced. So Nasria, yes, in that is researching as the rest of the world is doing. In the end, it will be a collaborative effort where we will now know for this period of lockdown how much carbon dioxide, how much sulfur dioxide, nitrogen, and etc. Has been reduced and all that. So it's really the physical appearance of the environment. In places where they have serious gaseous emission, you will see during that lockdown, the skies would have cleared. And in areas where you don't have that, you still know that something has happened. So Corona has, the impact basically is that we have a cleaner environment. In other words, Corona turned out to be the Nasria that they enforced. By default, people shut down and no emission was going. The second question as to whether private schools, how many have they been disinfected? Well, I stated earlier that we will not be decontaminating or disinfecting private schools. However, according to the guidelines we give to the private schools, they will do their own decontamination and disinfection, and they will follow the protocol, one of which is to hire licensed environmental health officers who know their way around these chemicals and the mixing, the application, the spraying, and all that stuff. So, and I know a lot of them have done it. And let me state, private schools are profit-making. Parents are aware that we need to decontaminate. We have done it in the public school, and it will be in the best interest of these public school, private schools, to decontaminate so that the parent will keep their kids in their schools. Otherwise, they will risk losing pupils. So they have done. I know I cannot guarantee if every single one of them has decontaminated, but we are aware because we have people who are keeping track of the private schools. Thank you.
Question from news agency was about whether a patient with COVID develop some immunity which protect them from reinfection from COVID. So what I can say is that, as we all know, it's a new disease. We are still learning, and studies are still going on. There is some evidence that some patients, after infection by COVID, do develop some level of protection, some level of immunity. They produce antibodies which can protect them from the infection. However, we don't know for sure how strong is that immunity or how long it will last. So we are still studying it. There are some studies, like three recent ones published in Europe, which show that the half-time, meaning the time the antibodies in the blood reduce by half, the level, the title, it's about 75 days. So around after 3 months, that's why those studies suggest that after 3 months, that immunity can wane. But as I said, we are still learning. It needs more evidence. That's why WHO has advised countries to participate in those studies so that we can better understand what's going on when someone is infected by coronavirus. Thank you.
To deal with. Friday, you did ask about sample collection and how government at the federal level is assisting the state governments. The responsibility for sample collection is that of the state governments. And I believe that in the coordination of our national response at the federal level, we've done everything possible to assist the state governments in undertaking that responsibility. We've done it either collaboratively with the other partners that are engaged in this. COVID has set up a couple of collection centers across the country. The NMPC has deployed resources and material with its partners, and at the federal level, all the test kits that come in, all the BPEs that come in that we have received as donation or contribution from different countries and different agencies, development partners, all the procurements that were done by the UN Single Basket Fund, all the support that we received from JACMA, from the Chinese government, from several other governments, the ventilators that we've received from the United States, everything that we have received are shared across the entire nation. Because the responsibility for managing COVID-19 resides substantially with the subnationals and the local governments within their constituencies. In addition to that, you've heard us speak about resources that are either being deployed or have been deployed. The states are receiving some facilities which was being coordinated by the Nigerian Center for Disease Control, I believe is the RENDESI. Virtually all the states have received or they are going to receive for the purposes of risk communication, consultation, sensitization, and general coordination for the national response, ₦100 million naira each. In addition to that, if you have followed the revised 2020 budget, there has been a provision in our revised 2020 budget where 32 states would get ₦1 billion naira each for the purposes of driving the processes of our response to this COVID-19. Lagos did get their own first 10 billion, Kano 5 billion, then Jigawa and Ogun got $1 billion each. But in the budget now, there is a provision, and the budget has become an appropriation act, where each of the 32 remaining states plus the Federal Capital Territory will get $1 billion each for the purposes of addressing the matters of COVID-19. The World Bank too has extended some facility to the states, totaling about $104 million. By the time that is wrapped up, it's another $1 billion each to each of the states to address issues of health infrastructure. So that is as far as the monetary contributions are concerned. By the time it is all said and done, on the average, each of the states will be receiving about 2.1 billion naira as support, as grant to the various states to address the issues of COVID-19. So I think, by and large, in addition to giving the coordination at the national level by developing the protocols and also putting up a national response into which each and every state fits in, resources have been provided for that. Material that have come through donations have been shared. Even the procurement that the Ministry of Health and the Center for Disease Control are embarking on. When they get these things, they don't keep them. They send them out to the 36 states and the FCT, to either the health institutions that are owned by the states or to the federal medical centers and the tertiary teaching hospitals in the various states for the purposes of coordinating and making sure that we have enough resources and material to continue our fight against COVID-19. The second question has to deal with, I think it was the question to deal with crowd management and control, isn't it? As to the experiences of Edo, whether there are penalties. You see, this is the irony of the whole thing. The federal government does not set up task force or mobile courts. Mobile courts are the responsibilities of the states. In the case of Edo, all the political parties are involved in rallies and campaigns. I won't lie to you, it will be very difficult for the state that is running an election with the incumbent governor who is seeking for mandate to begin to apply the protocols and the rules that he himself has set, because the quarantine legislation in that state was signed by him, was issued by his government. So for us at the federal level is to give guidance. But I've had cause to speak about this, that the experiences of our electionary campaign must be guided, must be properly handled, so that we do not escalate the community transmissions in those particular areas. And I will use this opportunity to appeal to the people of Edo to be very cautious in this campaign exercise. You can pass your messages through. and reach as many people as possible through different platforms and different media structure. Today, through social media, through Twitter handles, through Facebook, through Instagram, you can reach even many more people than asking people to congregate in one place. I'm eager this evening to watch the Democratic Party convention in the United States. For the first time, probably, in the almost 300 years of the experiences of politicking in the United States, a major party is going to nominate its candidate and receive acceptance speeches and speeches by former president through a different platform and structure that has never happened. So we must begin to reinvent ourselves in the way we do our politics going forward. If the Democratic Party in the US today will start its convention, and it will be a virtual convention happening in different locations all over the country. And the news and the information will placate the entire nation and the entire globe. In our politicking and management of our parties going forward, we must begin to develop that, because the new norm, the new normal has caught up with us. We don't know when we will get back, if we will ever do that, to our ways of life. So I think basically these are the two things, the two questions. But just to wrap up by saying that some states are doing a lot with regards to their sample collection. And we believe that with these resources being deployed to the states, we will be able to enhance our capacity for sample collection. I was listening to the CDC DG in the US and Dr. Fauci, and they were talking about America testing about 800,000 on a daily basis. And all of them came to the one logical conclusion, that 800,000 tests a day is not sufficient. That presupposes that we need to wake up. The subnationals need to wake up, because the rate of community transmission in our country is very, very expansive now in terms of intrusion into the different parts of the country. The last time we gave you statistics now, there are only 85 states, isn't it, local governments, that have not tested and have not reported a case. Probably by the time we will come back with a statistic, we will tell you that the entire 774 local governments have tested and have reported a case. So if you have an infection or communication of an infectious disease at that level, you know that virtually everywhere has been placated by that infection. So as long as we do not find, we do not test, we do not dictate, even the prevalence of the infection will be very difficult to determine. We cannot say for certain what is informing our low fatality in this country. I believe that probably our scientists will begin to look at the epidemiological data that is required to deal with that, so that we can have some semblance of an idea of why certain things are happening in other parts of the world, and we are seeing very adverse effects in terms of fatalities. Here we are seeing low figures. What is happening? Is it the novelty of the virus that is undetermined and unpredictable? Or is it a different COVID? So these are things that I believe that as our scientists and medical experts begin to explore, by the time we come to the closure of the first 6 months of the Presidential Task Force, we should be able to say for certain, this is what we have seen, this is where we are, and these are some of the things that we need to begin to put in place going forward. So we're encouraging all subnationals to expand their testing as the resources are made available, as the testing material are made available to them. That should be our drive, so that collectively we'll be able to fight this pandemic. Thank you and have a good evening.
Thank you very much, Chairman PTF. That brings us to the end, is testing. We are fully in the community spread phase, and one of the major measures we can take is to keep testing, to detect, treat, and isolate. How do you get tested? We have been taken through the process of getting tested. We have been advised that if you develop any symptom, get tested. Do not self-medicate. Seek information from the right places. Convince other people to get tested. Do not stigmatize. Do not discriminate. Eschew disbelief. God bless Nigeria. We hope to see you on Thursday. Okay.